Have you noticed your erections are not as strong as they used to be, even though nothing in your routine has changed? You might think it is stress, age, or tiredness, but sometimes the real cause is right in your medicine cabinet. Up to 1 in 5 cases of erectile dysfunction are linked to medications. And the tricky part is, it can happen slowly, so you do not connect the change to the pills you take. That is why this is so important to talk about. I want you to think about every medication you are using right now. Keep those in mind because we are going to go through some common ones, and you might recognize one on this list. First, opioid painkillers. Medicines like morphine or codeine can be life-changing for pain relief, but when used for a long time, they can lower testosterone and reduce sexual desire. This can make erections weaker or less frequent. We will come back to how this can be reversed later. Next, antidepressants. Medications such as fluoxetine, sertraline, and paroxetine are effective for mood, but they can make it harder to feel sexual excitement and maintain an erection. The good news? In some cases, changing the dose or switching to a different medication can help without losing the benefits for your mental health. Blood pressure medicines are also important to check. Beta blockers like propranolol and atenolol can reduce blood flow to the penis, making arousal and erection more difficult. Not all blood pressure drugs have this effect, so there are often alternatives your doctor can suggest. Then we have anti-anxiety medicines like clonazepam and alprazolam. They calm the nervous system, but when used long-term, they can lower sexual desire and affect performance. Finally, certain medicines for autoimmune conditions, such as methotrexate, can interfere with hormone balance and blood circulation. Over time, this can lead to erectile difficulties. If you have been dealing with erection problems, write down all the medicines you take and share that list with your doctor. Even if you have taken the same medicine for years without trouble, side effects can develop later. And here is the hopeful part. Research shows that when medication is the cause, improvement can often happen within 1 to 3 months of making adjustments. So do not ignore changes in your sexual health. They can be a signal worth paying attention to, and sometimes the solution is as simple as reviewing your medications. If you found this helpful, share it with someone else who might need this information. And for more advice to protect your health and confidence, subscribe and turn on notifications so you do not miss the next video.